Next to the common cold, ear infections are the most commonly diagnosed childhood illness in the U.S. 6 News anchor Lori Tucker is on your side tonight with Caring for Our Kids.
Hi, Kristen. You know, most children have had at least one ear infection by the age of 3, and it can really be tough to decide if your child's earache can be treated at home or if it's something that needs a prescription. Well, joining us now to talk about that is Dr. Ryan Redmond, ER Director for Children's Hospital. Always good to see you.
Thank you.
First, let's talk about the signs and symptoms we need to look out for.
Certainly, with older kids, they can usually tell you pretty specifically that, hey, my ear hurts, and it's usually something that happens, of course, in the middle of the night, you know, with no preceding symptoms. Younger kids can be a little bit more difficult. Sometimes it can just be fever and fussiness.
Okay, maybe pulling at their ear a little bit, that kind of thing. What are the main things that can cause an ear infection?
Well, kids are a little bit more prone to them just because of their anatomy. Their eustachian tubes, the tubes that kind of drain the pressure from their ears, are smaller. They're a little bit more horizontally kind of adjusted, so they tend to get fluid buildup behind their ears, and bacteria kind of loves that fluid to propagate in.
All right, what treatment? What are the best things to do, you know, if we see our child and they're in distress, and it is at 3 o'clock in the morning?
Certainly. So someone who's in significant amount of pain or has a significantly abnormal exam, you certainly still want to use antibiotics. Now, of course, in the general conversation that we've been having as a medical community about judicious use of antibiotics, we've kind of determined that there's a lot of these that will get better on their own and can be okay with symptomatic care. But if you're having significant symptoms or high fever or a lot of pain, then certainly treatment with antibiotics and pain medicine is still warranted.
And get that down. And, you know, preventing these, is there a way to, you know, we've got swimming pools, we've got other things. What can we do to help try to prevent this problem?
So the biggest thing to help kind of prevent these that we've been able to determine by the literature is going to be avoidance of secondhand smoke, because we know that that is a big predeterminant of whether or not you're going to be prone to ear infections.
How does that work?
There's a little bit of debate on it, but the biggest thing is that there seems to be an actual kind of eustachian tube dysfunction that can be caused by some of the chemicals in secondhand smoke.
Wow.
So it's a direct exposure kind of thing that if you get that out of the environment, that ear health seems to improve. The other thing is the importance of vaccinations, because a lot of the bacteria that tends to propagate on the inside of the eardrum are well controlled by our vaccines that we have right now. So following your normal vaccine schedule is really important in helping prevent these.
Very interesting. And also, a final question, when do we need to bring our child to the doctor?
Well, certainly anything that has significant pain, significant fever, or any changes in appearance. So if you see redness, swelling, the ear looking differently than it does, or having any drainage, that needs to be evaluated.
Always. All right. Well, thank you so much. Always good advice. Dr. Redmond, thank you for being here. And if you have a question about your child's health, just send me an email, ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30 for Caring for Our Kids.